You lean close to your dog or cat and suddenly smell something sharp, rotten, or metallic. Then you notice yellow-brown buildup on the teeth. Maybe your dog has started chewing on one side or dropping kibble. Maybe your cat still eats, but pauses over the bowl as if deciding whether the pain is worth it. You call for a dental estimate, hear a number that makes your stomach drop, and wonder, is this really necessary? Is this an emergency? Am I paying for something my pet may not need? That question is understandable. Dental procedures can be expensive, but the dangerous mistake is judging the mouth only by how white or dirty the visible teeth look. A pet with heavy tartar may not be in immediate crisis, while a nearly normal-looking tooth may be fractured or infected below the gum line. Today I will show you the signs to check before you delay, approve, or compare the cost of a dental procedure. You will learn which changes suggest routine disease, which mean your pet should be examined soon, and which warning signs require urgent care. Stay with me, because one of the most important signs is not inside the mouth at all. Hi everyone, I'm Dr. Chen, your pet care guide, and welcome back to Dr. Chen Pet Care. By the end, you will know how to perform a safe 1-minute mouth check, what never to attempt at home, what a dental estimate may include, and how to build a realistic routine. What is happening below the gum line? A soft bacterial film called plaque forms on the teeth. If it is not removed, minerals in saliva can harden it into tartar, also called calculus. The gums may become red and irritated. That early inflammation is called gingivitis. When disease moves deeper, the tissues supporting the teeth can become damaged. This is periodontal disease. The problem is no longer just a dirty tooth. It may involve painful pockets around the tooth, infection, loss of attachment, and damage to the supporting bone. I want you to understand this. The part you see is only the crown. A large amount of disease may be hidden under the gum line or around the roots. Looking at the front teeth for a few seconds cannot reveal the full condition of the mouth. Dental X-rays, also called radiographs, can show root disease, bone loss, and other damage that may not be visible during an awake inspection. Dogs and cats also hide oral pain well. They may keep eating because eating is necessary. A dog may swallow kibble with little chewing. A cat may shift food to the less painful side. Finishing dinner does not prove that the mouth is comfortable. Here is where many owners make a mistake. They wait until the animal stops eating completely. You did not miss the problem because you do not care. Most owners were never shown what subtle dental pain looks like. Your pet cannot point to one tooth and say, "This hurts." The clues often appear as changes in smell, chewing, mood, grooming, or tolerance of touch. The signs most owners miss. The first sign is persistent bad breath. I do not mean the temporary smell after fish-based food. I mean an ongoing foul, rotten, sour, or metallic odor that quickly returns. Bad breath is not simply a normal feature of aging. It may be associated with plaque, inflamed gums, periodontal disease, infected tissue, or another oral problem. It does not reveal the exact diagnosis, but it deserves an examination rather than being covered with a mint-flavored treat. The second sign is a change in the gums. Healthy gum color varies, and some animals naturally have dark pigment. Look for a change from your pet's normal appearance, a bright red line where the gum meets the tooth, swelling, bleeding, an ulcer, a raw area, or tissue pulling away from a tooth. Buildup during chewing or brushing is not proof that the toothbrush is working. It may mean the tissue is inflamed or injured. The third sign is a change in eating. Watch instead of merely checking whether the bowl becomes empty. Does your dog approach food eagerly and then hesitate? Does your cat sniff, lick, and step away? Is food falling from one side? Is your pet chewing on one side? swallowing pieces whole, preferring soft food, refusing hard treats, or taking longer to finish. Dental pain is not the only possible cause, but it belongs on the list. The fourth sign is unusual mouth behavior, repeated lip licking, heavy drooling, pawing at the face, rubbing the muzzle on furniture, jaw chattering, resisting a collar being placed over the head, or flinching when you touch the cheek can suggest discomfort. One sign alone does not prove dental disease, but two or more signs together, especially with bad breath or appetite changes, should not be ignored. The fifth sign is a damaged tooth. Look for a tooth that is cracked, loose, missing a piece, positioned differently, or darker than the matching tooth on the opposite side. Gray, purple, tan, or pink discoloration can indicate injury inside the tooth. Do not press on a broken tooth, wiggle it, or offer a hard chew to test whether your pet can still bite. The sixth sign is swelling or drainage. Swelling beneath an eye, along the jaw, under the chin, or on one side of the face may be connected to an infected tooth root or another serious problem. You may also see blood, pus, a draining opening, or discharge from one nostril. This is not a brush for a week and see situation. Contact a veterinarian promptly. The seventh sign is a personality or whole body change. A social dog may become quiet, restless, or irritable. A cat may hide, groom less, or resist handling. You may notice weight loss, lower energy, or disturbed sleep. These are not dental-specific signs, which is why they are easy to dismiss. The mouth may be involved, but other medical causes may also need to be considered. Now look outside the mouth. Compare both sides of the face in good light. Facial asymmetry, swelling under one eye, a new bulge along the jaw, or pain when the head is lowered may be more urgent than visible tartar. A dirty-looking mouth may need scheduled care. A swollen face may signal active infection, trauma, or another condition requiring faster attention. Dental emergency or not. Let us make this practical. I divide dental concerns into 3 levels. Schedule an examination, arrange an examination soon, and seek urgent care. The first level is usually not an emergency, but it still needs action. Examples include mild, persistent bad breath, visible plaque or tartar, a thin red gum line, or no home care routine. Your pet is eating and behaving normally, with no swelling, bleeding, broken teeth, or obvious pain. Call your regular veterinarian and schedule an oral examination. Do not wait for dramatic symptoms. The second level means your pet should be examined soon. This includes worsening odor, bleeding gums, dropping food, chewing on one side, refusing hard treats, repeated pawing at the mouth, a discolored tooth, a suspected fracture, or a noticeable appetite or behavior change. An emergency hospital may not be necessary in the middle of the night, but delaying for weeks or months is not sensible. Call the clinic, describe the signs, and ask how quickly your pet should be seen. The third level is urgent. Seek prompt veterinary guidance for facial swelling, uncontrolled oral bleeding, a jaw injury, severe pain, an object trapped in the mouth that you cannot safely remove, sudden inability to close the mouth, difficulty breathing, repeated choking motions, collapse, or refusal of both food and water with obvious distress. If there was trauma, chemical exposure, an electrical cord bite, or a possible toxin, say so immediately. Please listen carefully. Breathing difficulty, rapidly increasing facial or throat swelling, heavy bleeding, major trauma, weakness, or unresponsiveness are emergencies. Call the nearest veterinary emergency service while preparing to leave. Do not delay urgent care to try internet remedies, what you may actually be paying for. Now we reach the reason you clicked. Before you pay for an expensive dental cleaning, Check the signs, but do not use those signs to talk yourself out of necessary care. Use them to understand urgency and ask better questions. A comprehensive veterinary dental procedure may include an examination, anesthesia planning and monitoring, evaluation of every tooth, probing around the gums, cleaning above and below the gum line, polishing, dental radiographs, treatment of diseased teeth, pain control, and recovery care. The cost can change if extractions or other treatment are needed. An awake glance may identify concerns, but it cannot fully show what is happening beneath the gums. That is why two estimates labeled dental cleaning may not describe the same service. One may include full mouth radiographs and detailed monitoring. Another may list radiographs, extractions, medications, or pre-anesthetic testing separately. The cheapest number is not automatically the best value, and the highest number is not automatically justified. You need the details. Ask what is included in the base estimate. Are dental radiographs included? Will the team evaluate below the gum line? What monitoring is used during anesthesia? Is pre-anesthetic testing recommended for this particular animal? How will pain be managed if extractions are needed? Will the clinic contact you before exceeding an agreed cost range when possible? What aftercare is included? Also ask what could move the estimate toward the higher end. A tooth that looks acceptable while your pet is awake may show root damage or bone loss on radiographs. That does not automatically mean the estimate was dishonest. It means the complete examination revealed information that could not be obtained safely from a conscious, moving animal. Some owners are frightened by anesthesia, especially with a senior pet. That fear is reasonable, but age alone does not determine whether anesthesia is appropriate. The decision should be individualized based on the examination, medical history, current medications, testing when indicated, and the procedure being planned. Ask how risk will be assessed and managed. A proper dental procedure uses anesthesia because the patient must remain still for examination, cleaning beneath the gum line, radiographs, and treatment without fear or pain. Veterinary dental organizations caution that cosmetic scaling on an awake animal does not address hidden disease and may create false reassurance because the visible teeth look cleaner. The mistakes that make dental problems worse. The first mistake is scraping tartar at home with a metal tool. Please do not do this. One sudden head movement can injure the gums, tongue, or tooth. You may remove a visible flake while leaving disease beneath the gum line. Scraping can also roughen the tooth surface when it is not followed by proper polishing. Whiter does not mean healthier. The second mistake is using human toothpaste, mouthwash, whitening products, or random homemade mixtures. Human products are designed to be spit out, but animals swallow what enters their mouths. Some may contain inappropriate or dangerous ingredients, including xylitol in certain human dental products. Natural and people-safe do not automatically mean pet-safe. Never apply essential oils, alcohol, hydrogen peroxide, concentrated vinegar, or harsh powders inside your pet's mouth. Never give human pain medication. Ibuprofen, naproxen, acetaminophen, and other human drugs may be dangerous to dogs or cats unless a veterinarian has created a specific treatment plan. The third mistake is covering bad breath with chews while ignoring pain. An appropriate dental chew may support plaque or tartar control, but it cannot repair a fractured tooth, remove advanced disease beneath the gum line, or treat a tooth root infection. If chewing seems painful, stop hard dental products until the mouth is evaluated. The fourth mistake is giving very hard objects as natural tooth cleaners. Bones, antlers, hooves, ice, and extremely rigid chew items can fracture teeth. If an object is very hard, does not flex, and does not soften, it may be too aggressive for a pet that bites forcefully. Choose size-appropriate products and supervise chewing. The fifth mistake is beginning vigorous brushing when the mouth is painful. Brushing is useful for prevention, but forcing a brush against bleeding gums, a loose tooth, a fracture, or severe inflammation can cause pain and lasting fear. If your pet suddenly resists after previously accepting brushing, stop and investigate. Resistance may be communication, not stubbornness. The sixth mistake is deciding a senior animal is too old to deserve an oral evaluation. Older dogs and cats may have additional health considerations, but chronic mouth pain should not be accepted as normal aging. The goal is not cosmetic perfection. The goal is comfort, function, and an informed plan. What you can safely do today. Begin with observation, not force. Choose a calm moment. Sit beside your pet, rather than leaning over the face. Gently lift one side of the lip, without prying the mouth open. Look at the outer surfaces of the teeth and gum line, then check the other side. Stop if your pet pulls away, growls, cries, pants heavily, scratches, or becomes distressed. Look for odor, redness, bleeding, swelling, broken teeth, unusual color, missing pieces, and material trapped between teeth. Compare both sides of the face. Watch the next meal closely. Record hesitation, drop to food, uneven chewing, or refusal of certain textures. Clear photos and a short video of eating behavior may help the veterinary team understand what you see. Do not place your fingers deep into the mouth of a painful or frightened animal. Even a gentle pet can bite reflexively. Do not pull string, thread, fishing line, or another object caught under the tongue or extending down the throat. Pulling may cause serious internal injury. Prevent further chewing and contact a veterinarian. If the mouth appears comfortable and your veterinarian has not identified a reason to avoid brushing, introduce home care gradually. Use a soft pet dental brush and toothpaste made for dogs or cats. Let your pet taste a tiny amount first. On another day, lift the lip and briefly touch the outer tooth surface. Slowly build toward brushing the cheek-facing surfaces, especially the upper teeth, where plaque and tartar commonly collect. Do not turn brushing into a wrestling match. A calm, brief session repeated consistently is more useful than one aggressive session that teaches your pet to hide. Reward cooperation with praise, play, or an appropriate treat. For animals that will not tolerate brushing, ask your veterinarian about alternatives, such as certain dental diets, chews, water additives, wipes, or other products. Products accepted by the Veterinary Oral Health Council have met its standards for helping control plaque or tartar. They are aids, not substitutes for diagnosis or treatment when disease is already present. Cats require extra patience. Do not restrain a frightened cat and force the mouth open. Begin by touching the cheek, lifting the lip for 1 second, and stopping before the cat struggles. Use cat-specific products. Dogs and cats are not small humans, and cats are not small dogs. The safe daily routine. Every day, notice your pet's breath and watch the first few bites of one meal. You are looking for change, not perfection. Is the odor stronger? Is chewing slower? Is food falling? Is your pet avoiding a favorite hard treat? Several times each week, lift the lips for a quick look if your pet allows it comfortably. Check the gum line, visible teeth, and both sides of the face. This should take less than a minute. The more familiar you are with normal, the faster you can recognize abnormal. Brush regularly with species-appropriate toothpaste and a soft brush once your pet accepts it and the mouth is not painful. Daily brushing is a useful goal, but do not abandon the habit because you missed a day. Resume calmly. Consistency matters more than guilt. Use only size-appropriate dental products and supervise chewing. Stop a product that causes choking, vomiting, bleeding, broken pieces, constipation, or difficulty swallowing. Dental treats contain calories, so count them as part of the daily food intake. Arrange oral examinations as part of preventive veterinary care. Ask how often your individual dog or cat should be examined and when a professional procedure may be recommended. Small dogs, flat-faced breeds, animals with crowded teeth, pets with previous dental disease, and some cats may need closer attention, but the schedule should be individualized. Keep a brief record. Note when you first noticed odor, bleeding, appetite changes, swelling, or a damaged tooth. Record which side seems painful and whether the problem is improving, stable, or worsening. Bring the medication list and relevant history to the appointment. When home care is not enough, home care supports prevention and maintenance. It cannot diagnose root damage, repair a fracture, treat an abscess, stabilize a jaw injury, or safely remove disease hidden beneath the gum line. Once tartar is firmly attached, brushing will not remove it. Once a tooth is painful or loose, trying harder at home is not the answer. This is the part I do not want you to ignore. Contact a veterinarian promptly for facial swelling, pus, ongoing bleeding, a broken or loose tooth, severe odor with appetite change, obvious pain, weight loss, difficulty opening or closing the mouth, or sudden refusal to eat. Seek urgent help for breathing difficulty, major trauma, rapid swelling, heavy bleeding, collapse, or suspected toxin or electrical injury. When something feels wrong, trust your instincts and contact your veterinarian. You know your pet better than anyone. Tell the clinic what changed, when it began, whether your pet can eat and drink, whether swelling or bleeding is present, and whether trauma or exposure may have occurred. Before you pay for an expensive dental cleaning, check these signs: persistent bad breath, red or bleeding gums, altered chewing, drooling or mouth rubbing, broken or discolored teeth, facial swelling, and changes in behavior or appetite. Then use what you find to ask better questions, not to diagnose the problem alone. Ask what the estimate includes. Ask about radiographs, anesthesia monitoring, pain control, possible extractions, and aftercare. Ask what can be decided beforehand and what may become clear only during a complete examination. Discussing cost is responsible, but choosing a cosmetic shortcut while disease remains beneath the gum line may cost your pet more pain and may cost you more later. Your action plan is simple. Check the face and mouth gently. Watch one meal. Record changes. Do not scrape teeth or use human products. Improve safe home care only when the mouth is comfortable. Schedule an examination for ongoing signs and treat swelling, trauma, breathing difficulty, or severe bleeding as urgent. Now I want to hear from you. What was the first dental sign you noticed in your dog or cat? Bad breath, tartar, bleeding gums, chewing changes, or something else? Tell me in the comments. It may help another owner recognize the problem earlier. If this video helped you understand the difference between routine dental care and a possible emergency, please like the video, subscribe to Dr. Chen Pet Care, and share it with another pet owner. Give your dog or cat a gentle scratch behind the ears for me. Stay observant, trust your instincts, and I'll see you in the next video.